I'm Dr. Frita, and today I'm giving you 17 drugs, supplements, and medications that can raise your blood pressure and cause hypertension. We have all taken some form of drug or supplement, and the point is to make us feel better, to make us healthier, right? But in actuality, there are many medications and supplements that can actually be harmful to you by making you have high blood pressure. It's true. According to the American Heart Association, nearly half the adults in the United States have high blood pressure, and many don't even know it. So imagine that if on top of that, you're also taking medications and supplements that are making your blood pressure high. That could lead to catastrophic hypertension. High blood pressure is a leading cause of heart disease, strokes, and kidney failure. So I know you don't want to take medications that can actually make your blood pressure worse, do you? I know you don't. So today we're going to talk about it. I'm giving you 17 drugs, supplements, and medications that can raise your blood pressure and cause you to have hypertension. Keep watching. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. Be sure to like this video and to subscribe to my channel as we get started. Also, hit that notification bell so you'll be among the first to know when I release new content. I'm Dr. Frita. I am a board certified kidney doctor and high blood pressure doctor. So I have personally seen these medications raise the blood pressures of some of my patients in my very own practice. I want you to remember that different people react to the same medications differently. So just because you might hear a medication or supplement that you're taking, that doesn't mean for you to automatically stop it and throw it away. What it does mean is that you need to have a conversation with your doctor, consult your physician, and monitor your blood pressure closely. Let's start with some of the over-the-counter pain medications, like the NSAIDs or non-steroidal anti-inflammatory drugs. Number one, ibuprofen. Examples of ibuprofen include Advil and Motrin. And yes, I know these medications are great for pain relief and for inflammation. The truth of the matter is that they can potentially cause high blood pressure. And this is how. When you take ibuprofen, it causes you to retain water. It can also cause a decrease in your kidney function. Yes, it can decrease the way that your kidneys filter. It can also cause your blood vessels to tighten or constrict. This can lead to high blood pressure. Number two, naproxen. An example of naproxen is Aleve. And we know that that's a very strong pain medication as well. A lot of people take it for headaches, for menstrual pain, for, having different types of arthritic pains or sports injuries. Very, very popular. And in some people, they do just fine. But just like ibuprofen, naproxen also has the potential to raise high blood pressure because it too can make you retain fluid, can cause the kidney function or the GFR to decrease, and it can cause vasoconstriction. So yes, naproxen can also raise blood pressure in some people. Question. Did you know that some of the latest health hacks that keep showing up in your headlines can actually harm you? Yeah, we need to talk about that. That's why I want to invite you to join me right here live on this YouTube channel for Medical Mondays. I break down all of the hot health headlines in the news. I give you evidence-based medicine. We talk about myth versus fact, and we keep it fun. You even have a chance to interact with me live and ask some of your questions. I give you a fresh take on medicine that you can't get anywhere else. So please go ahead and mark your calendars for Mondays at noon Eastern Standard Time and join me for Medical Mondays. Let's make Monday your healthiest day of the week. Number three, high dose aspirin. Now, I'm not necessarily talking about the low dose 81 milligram aspirin that you might be taking to prevent heart disease and stroke. Specifically, the high dose aspirin can put you at a higher risk for high blood pressure. Yes, it can cause fluid retention, it can cause a decrease in kidney function, and it can cause a tightening of the blood vessels. Aspirin can do other things as well. When you're taking a high dose of aspirin, it can increase your risk for bleeding. So for peptic ulcer disease, or if you have a fall, it can increase your risk for a head injury or a brain bleed. Number four, COX-2 inhibitors. An example of a COX-2 inhibitor is Celebrex. And oh my gosh, these COX-2 inhibitors are so wonderful as far as anti-inflammatory properties. Yes, if you have arthritis or a sports injury and you've ever had a COX-2 inhibitor, it really does work well. But yes, it can increase your risk for high blood pressure. Same mechanism or similar mechanism. It can cause water retention, can cause the blood vessels to tighten. It can cause to a heightened blood pressure. Now remember, if you're taking these medications, it does not mean that you have to automatically stop and it's going to ruin your life and ruin your blood pressure. But if you already have high blood pressure or difficult to control blood pressure, consult with your doctor and you may need to find an alternative because yes, these medications, these NSAIDs, aspirin, COX-2 inhibitors definitely can elevate your blood pressure. Also, and I've done this firsthand as a kidney doctor, as a nephrologist, I've had patients who've taken these medicines and not only have they had elevated blood pressure, but they've also had kidney failure and I've had to dialyze them. Yes, NSAID nephropathy, okay? Nephropathy or kidney disease from medications like Aleve, ibuprofen, when taken in patients who already have vulnerable kidneys, yes, it can lead to kidney failure. So again, don't run, don't panic, don't throw away the medications, but it's definitely worth the conversation because these meds can cause high blood pressure. As I go through this list of meds that can raise your blood pressure, I want you to tell me which of these drugs, supplements, or medications surprised you. Please drop a comment down below and let me know. Number 5, decongestants like pseudoephedrine or Sudafed. Yes, yes. When you take pseudoephedrine, it can definitely help to relieve nasal congestion because it narrows the blood vessels in your nose or in your nasal passages. And by narrowing these blood vessels, that helps you with being congested. Okay, that's why you take it. The issue is that in addition to narrowing the nasal blood vessels, it can also narrow blood vessels in the rest of your body, and this can lead to high blood pressure. Number 6, corticosteroids. Now, this is a big one. I'm talking about prednisone and other oral steroids. Yes, we know these medications can be great if you're having an allergic reaction, if you're having a lupus flare or some other autoimmune flare, if you're having a gout attack. Yes, you may have taken prednisone or other corticosteroids. They can lead to high blood pressure. And I witness this in my practice every single week. What happens is that the corticosteroids cause you to retain sodium or salt. This also leads to fluid retention, which can increase the pressure in your blood vessels, causing high blood pressure. So make sure that if you already have high blood pressure, you're monitoring it very closely if your doctor prescribes steroids or corticosteroids. Also, even if you don't have high blood pressure, keep an eye on your blood pressure to make sure that it does not get high on these corticosteroids. In addition to causing high blood pressure, corticosteroids can have other side effects as well. They can cause you to have an increased blood sugar, so watch out for my diabetics and pre-diabetics. They can also cause you to gain weight. They can cause you to have increased weight in your face or have what they call a moon facies. They can cause you to have increased weight in your back, in your upper back, increased abdominal obesity. They can cause you to have easy bruising, stretch marks, things of this nature. So I definitely do prescribe corticosteroids. They have their place and I find them to be very necessary in my practice, but it is important to understand that corticosteroids have side effects, one of which is raising your blood pressure. Number 7, antidepressants like venlafaxine or Effexor XR. Now, yes, managing your mental health is of the utmost importance, absolutely. And many people are taking antidepressants, not only just for depression, but also to manage anxiety, to manage panic disorders. But it's important to know that certain antidepressants can increase your blood pressure, and this is how. They can cause a narrowing or a constriction of your blood vessels. They can also cause an alteration in your brain, in your central nervous system. They can affect the way that your brain helps to control your blood vessels and high blood pressure. So just make sure that when you're taking an antidepressant, you let your doctor know if you have high blood pressure and you monitor your blood pressure carefully. If you're taking one of these antidepressants, please don't let this be a reason for you to stop. We don't want you to have any kind of a mental breakdown or to go into a major depressive episode. No, I'm just letting you know that it is a fact that some antidepressants can lead to high blood pressure or worsen hypertension. And so consult with your doctor. While we're talking about high blood pressure, I want to make sure I offer you a guide to controlling your blood pressure. And that's by purchasing my book, Under Pressure, A Guide to Controlling High Blood Pressure. In this book, I give you an integrative approach to managing your hypertension. I talk about the Western medicines, of course, and I trained at Meharry Medical College, Georgetown University Hospital, Emory University Hospital, so I'm well versed on all of the traditional medicines. I also talk about the holistic and natural approaches, using food as medicine, exercise, slow, deep breathing. So in this book, I give you a well-rounded view and strategy on how to control blood pressure. So make sure you get my book, Under Pressure, A Guide to Controlling High Blood Pressure. You can get it by going to my website, dr.frita.com, or just click the link in the description. Number 8, immunosuppressants. Yes, medications that are meant to suppress the immune system, like transplant medications, for example. Some of them can actually cause high blood pressure. Specifically, cyclosporin, also known as Sandimmune, Gengraf. And what it does is, in some cases, it can constrict vessels, affect your kidney function, and it can lead to high blood pressure. This is particularly frightening because sometimes it can be given to treat kidney diseases, right? If you have an inflammation in kidney cells, then sometimes cyclosporin is a treatment. But you have to balance it because it can also cause high blood pressure in some cases. Just make sure you consult with your doctor and monitor your blood pressure. Number 9, stimulants like Ritalin, Concerta. We know that stimulants are used to treat ADHD. Historically, ADHD, or attention deficit hyperactivity disorder, that was something that was traditionally diagnosed in children and especially in young boys. But now it's being uncovered that more and more adults have ADHD and are being treated with these stimulant medications. The issue is, the older you are, the more likely you are to have high blood pressure, or at least to be at risk for having high blood pressure. So if you've been diagnosed with ADHD and you take one of these stimulants like the Ritalin or like the Concerta, make sure you very carefully consult with your physician, monitor your blood pressure, because these stimulants can cause an increase in heart rate and an increase in blood pressure. Number 10, weight loss medications, such as phentermine. So this medication can cause high blood pressure by increasing the heart rate and having a resultant high blood pressure. Question, do you have any specific lifestyle change that you use to lower your blood pressure? Please comment down below. Number 11, migraine medications, specifically the triptans. The triptans can tighten blood vessels in the brain, which can help to relieve migraines, but they can also cause a tightening of blood vessels throughout your body, which can increase high blood pressure. So beware. Be sure to watch my video on the top 10 best exercises to lower blood pressure naturally after you finish watching this video. Number 12, oral contraceptives or birth control pills. Yes, we know these are commonly taken, and they can have a side effect of elevating blood pressure. The estrogen can cause blood vessels to tighten or constrict, which can lead to high blood pressure. So make sure you talk to your doctor. Also, oral contraceptives can put you at a higher risk of having blood clots or DVTs, especially if you smoke cigarettes and take oral contraceptives. Number 13, anabolic steroids can cause high blood pressure. So testosterone, performance-enhancing drugs. These medications can cause you to retain fluid, which can increase the pressure within your blood vessel walls, causing high blood pressure. They can also alter your cholesterol. Yes, they can lead to high cholesterol, which can ultimately lead to cholesterol plaques in your blood vessels and a narrowing of the blood flow, leading to high blood pressure. Number 14, caffeine. Ooh, I know y'all love to have your cup of joe. Y'all like to drink your coffee all day long and drink your sodas. Please cut back on your sodas. But caffeine, in some cases, can cause high blood pressure. We know that caffeine is a stimulant, and so it can increase your heart rate. It can also cause blood vessels to tighten, and it can increase the blood pressure in some cases. Now, does this mean that if you have high blood pressure, you absolutely can have no caffeine? No, not necessarily. But it does mean that you need to consult with your doctor and find out how much, if any, caffeine is okay for you to drink. Be sure to watch my video, Is Caffeine Bad for You?, after you finish watching this video. Number 15, nicotine and smoking. Y'all know cigarettes have no good news. You know that. Nicotine can give you high blood pressure. It can act as a stimulant, which releases adrenaline, that fight or flight hormone, and it can cause your heart rate to go up, and it can cause your blood pressure to rise as well. Long-term use of nicotine can damage blood vessels, leading to a stiffness, which of course can promote high blood pressure. And smoking cigarettes. Let me tell you, there's no good news with smoking cigarettes. Look at just about every illness and you'll see cigarettes. They're a risk factor for heart disease, high blood pressure. They're a risk factor for cervical cancer, lung cancer, COPD, emphysema, skin cancer. So smoking cigarettes is something that really takes years off of your life, and it takes a quality off of your life. And yes, smoking cigarettes can cause high blood pressure. The carbon monoxide from cigarette smoke reduces the oxygen in your body. This makes the heart work faster to try to get oxygenated blood to your tissues, and that can lead to high blood pressure. Smoking cigarettes, you have these tobacco chemicals, which can also damage blood vessel walls, and it can also promote plaque formation and atherosclerosis. It can promote poor circulation and just worsen high blood pressure. Please put the nicotine and the cigarettes down. Por favor. Number 16, alcohol. Yes, alcohol. Alcohol consumption can cause an increase in blood pressure, and it can reduce the effectiveness of your blood pressure medications. Number 17, energy drinks. I know I said that kind of loudly. Energy drinks. I know that's not a shocker. You know that energy drinks are loaded with caffeine. We already talked about that, but they can also sometimes be loaded with other stimulants, which can lead to a temporary increase in your blood pressure. So these are 17 of the drugs, supplements, and medications that can raise your blood pressure and cause hypertension. If you found this video to be helpful and informative, please be sure to like it and share it with the people you care about. Remember, some of these medications will cause high blood pressure in some people and not in others. It's important that you consult with your doctor, and it's very important that you monitor your blood pressure. When managing your blood pressure, yes, take the advice of your physician, and medications may be necessary for you. Also, try to incorporate lifestyle modifications, exercise, eat healthy foods, do slow, deep breathing, try to reduce your stress. Do all of these things, because managing high blood pressure is not just a pick A or pick B process. It's an integrative process. I want you to make sure that you continue to do your best to live your healthiest, happiest life. I appreciate your support. I appreciate you for watching. I'll see you next time. I'm Dr. Frita.